Hello and welcome to the Council here on Gay Life Television. I'm your host, David Dean. In this episode, I have with me Maria Ponzi, who has a master's degree in public health, and we're going to be talking about the Affordable Care Act, which you may know as Obamacare. And if you don't know anything about it, it's the reason that you might be getting a cancellation notice about your health insurance policy. It's also the reason that you may be paying a penalty for not having insurance next year. And we're going to be telling you about some things you should know, such as the exemptions, in case you can't afford it and you don't want to pay that penalty. So Maria.
Hello.
Hello. Can you tell us a little bit about, what would you say are like the top 3, 4, 5 changes that we're going to have coming here with the Affordable Care Act?
All right, yeah, I can do that. I guess the main concern that people have is the price. For those who do not have health insurance right now, they're not paying anything unless they're sick and then they go seek health care. Right now, the way that it's working out is the person is only supposed to pay no more than 8% of their total income. Now that is at the highest, most premium package that they can choose from in the marketplace. They can choose lower programs that would be less than that, but it should not be more than 8% of their income. So I guess that's the first thing that people should know about this. If they make less than, if they fall within the poverty level at any percentage point at all within the poverty level, then they can qualify for different tax credits to help pay for that. And what happens with the tax credits is something that's a little bit different that we're not used to. This is all done through the IRS when someone fills out their annual income taxes, and the credit will actually get sent straight to the insurance company. So it's all done on paper. They don't actually get something, they don't pay it first and then they get reimbursed. It's something that is sent directly to the companies themselves, which is something a little bit different that we're not used to.
Right. So hence the name, the Affordable Care Act. The idea is to make things more affordable for everyone. I know one thing that I've seen a lot of people concerned about talking about on Facebook is when they compare the policy that they have now to what's available to them through the Affordable Care Act. A lot of people say that they see their out-of-pocket expenses going up, mostly based on the fact that the Affordable Care Act has introduced these catastrophic plans at the bottom, and then like they work their way up these tiers so that with a catastrophic plan, minimal costs are really covered by the plan, and you have these high out-of-pocket percentages, and then as you go up, you end up with the plan covering more, but it's a higher monthly premium. Is there any official word on that in terms of, are we looking at feasibility? Are these plans going to actually cost some people more, or how's that going to work out?
Yes, some of these may cost people more. Normally, though, if you're in what's considered the middle class, it should not cost you more than what you are paying now. There's a lot of plans that are going to be grandfathered through, and this is something that just changed on Friday. There's a lot of plans that are going to be grandfathered through now. So even if within the last couple of weeks, if someone got one of those letters saying that their plan is going to end in April or June of 2014, they're going to probably be getting another letter this week retracting that and saying that it's not true. Now they're able to extend that all the way up to, I think it's 2015 at this point. And then after that, they're still going to have the option to keep that plan as long as the plan adds those 10 requirements that the Affordable Care Act is saying that all insurance plans have to have.
Can you speak about any of the specifics of what is the Affordable Care Act requiring that so many of these plans don't have right now?
Well, the big, huge one is preventative care. A lot of times, well, right now, your insurance, normally, you can only use it if you're sick. So if you want to go to your doctor and be like, hey, I just want a checkup, that's normally not something that's covered. You on this check a year, which is really, really exciting when you work in the healthcare field. Vaccines are now going to be available on that to little or very, very no cost, which again is extremely exciting. Any type of female reproductive health care, so birth control is going to be covered on that now, as well as mammography services. Those are 3 big changes that a lot of insurance plans before this didn't have.
Speaking of that, that makes me think of 2 things. One, a lot of people are wondering, My grandmother, who's in her 70s, is now going to have to pay for maternity coverage. And the reason for that is with any insurance, it's like a pool. And the more money coming in, the more the costs can be lowered and sustained. So the idea is if everyone's contributing a little bit, no, you may not need that coverage, but the overall cost to everyone becomes lower. Another thing I'm curious is, did you see where a couple of the Catholic dioceses here in Pittsburgh are, I believe, filing a federal lawsuit in terms of their refusal to cover those reproductive health care costs?
Yeah, as an organization, as a business, you can definitely file for that, saying that you don't want that as a part of the plan for your employees. Some agencies have won that, and they don't have to have that as part of their plan. Some have lost. Like the most recent one right now is Hobby Lobby. They applied to not have reproductive health care on their plans, and they lost, and now they have to pay for that even though they don't want to.
All right.
So yes, they can fight against that. Most of the time it has been approved, but sometimes it's not.
I guess it'll be interesting to see how that plays out for church-related organizations that are fighting that right now. All right. Another thing that's been in the news is the website. The website seems to have become a bigger hot-button political issue than the Affordable Care Act itself, because now we have all these congressional inquiries looking at how did things go wrong at the last moment. And it does look like what the government did was, when the website was supposed to launch, weeks before that, they changed how they wanted things to go. And so behind the scenes, everyone was scattering. I know I've browsed it the past few days and it seems to be up and running, but I hear that there are still problems with it. Have you looked into any of that?
Yeah, and actually on the way here, I was listening to the news, and they hired a new web developing company today. So apparently there's going to be a 4-hour time slot, and they have an announcement that's going to be where the site will be completely down, and they're going to go in there and try to look at it and repair it.
Well, that's nothing new.
I guess the biggest problem with the site is the databases that have to be linked to it. It has to be linked to the IRS database, so that way you can't lie about your income on it. It has to be linked to Medicaid and Medicare and CHIP, so that way when you're clicking on these buttons, it's all linking up and showing yes, 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 yes. She has coverage for this. She doesn't have coverage for that. And that's been their biggest problem, is just so much data to put on one interface that they're having a lot of problems with that. And I'm not very technological at all, but I kind of understood that.
Right. Speaking of Medicaid, I know that a lot of states, as part of the Affordable Care Act, were given the option to expand Medicaid to kind of bridge the gap between people who are currently enrolled in Medicaid and those who don't quite qualify right now, but would still be struggling to pay health insurance premiums out of pocket. Pennsylvania so far has not been one of those states. Can you talk about how that will affect people, depending on whether or not they're in a state that's expanding Medicaid or not?
If the state has expanded, then those who may not have qualified for Medicaid in the past will probably qualify for it now. For the states that have not expanded it, then they're going to have to go into the marketplace and they're going to have to purchase their health insurance, because that is their only option. They don't qualify for Medicaid. There was an expansion, so the money is not there to lower down that poverty line that they use as that cutoff.
All right. And of course, for people who still aren't quite qualifying for Medicaid coverage, there are the tax credits. Can you talk a little bit more about how those tax credits are going to work, who's going to get them, and
yeah. It's that's gonna vary from state to state. It does go by the federal poverty level, but how that's gonna work is from state to state. So let's say you're within 400% of the poverty line, which is what all the examples are that they're using with that.
And I think that takes a household income up to 40, 50, 60,000, depending on how many members. So it's a pretty generous range that's covering.
When we're talking about the middle class and the Affordable Care Act, this is a very, very good thing. Every once in a while, you get these people in the outskirts that are going to have to pay more. Normally, people are going to be able to afford what they're going to be told to purchase. And a big portion of that is from these tax credits. And what I was saying earlier, how they're going to work, you're going to fill out all the paperwork, you're going to go on the website, you're going to do all the stuff. At the very end, it's going to say, okay, you qualify for, I don't know, I'm just pulling this number out, $1,000 in tax credit. So what's going to happen then when you fill out your federal income tax return, that $1,000 is going to show up, and that's going to go straight to your insurance company. They're going to get that bulk payment.
All right. Maria, I don't mean to cut you off there, but we're going to take a quick break, and we will be right back to more on Obamacare after this. All right, welcome back. I'm here with Maria Ponzi. We're talking about Obamacare. Maria, we were just talking a little bit about the tax credits and how that was going to work. So you may pick up where you left off.
So how it's going to work, you're going to fill out your income tax return for the year. If your tax credit is going to show up on there, you're going to, once you turn that back into the IRS, that credit is going to go straight to your insurance company. So if your credit was $1,000, then it's going to take that off of your premium for the year, and it's going to divide it per month or per every 6 months, however you decide to pay your premium.
Okay, so then that money goes directly, so it's essentially like you're paying a smaller bill every month.
Yes.
And I also understand one thing is, as people were initially signing up, it's kind of predictive. Like it's asking you, how much do you think you're going to make next year? Do you just want to use last year's information because it's going to be about the same? And what may happen is, let's say you only think you're going to make a little bit of money and you make way more. Well, good for you, but you may have to pay back some of that tax credit.
That's correct.
Right. So what do you think the impact for healthcare providers is going to be with the Affordable Care Act?
Well, I think that they're going to be a lot busier because you're going to have people now that may not have had insurance their entire adult life now have insurance. So I would assume that most people are going to actually start using it. So then there's probably going to be quite an influx on the schedule for quite some time, which all around is a good thing. With this, the providers will actually get paid what they need to be getting paid. Previously, with how health insurance companies work, they made deals with different providers. Okay, well, I'm going to pay you this much, even though this test costs this much, and so forth. And now none of that's happening. It's all a set price. It is what it is, so they're going to get paid for that. Again, with their patients having health care, they're not going to get stiff with the bill, which is the whole purpose of this to begin with.
So do you see the reimbursement for providers possibly going up from their current contracted rates?
That's what they're saying, yeah.
Additionally, speaking of people who don't have health insurance, there's also going to be a penalty now if you don't buy health insurance. Can you talk a little bit more about that and how it works?
Yeah, what's going to happen, again, is going to be something that's going to be filed with your income tax return. In 2014, if you've been found to not have health insurance, I believe it's $94 or $97 is going to be the fine, but every year after that, it's going to increase. So it may be a one-time, very small fee at the beginning, but every single year that you go without insurance, it's going to increase. The only little caveat to that is that you can go 3 months every single calendar year without health insurance and not be penalized for it.
So let's say a person can't afford to or chooses not to pay for insurance at this time. They're going to fill out their tax return, they're not going to have insurance, and they're going to get charged that penalty. Is there a way for them to file an exemption for that?
There is a way. Exemptions are going to be tough, but honestly, it's all about the income. If you can prove that you cannot, absolutely no way, shape, or form are able to afford this, then you can file for an exemption. And if it gets approved, then it's approved. I don't know how often they're going to revisit that. I highly doubt it's going to be, an exemption for life. So I don't know if it's going to be on a yearly basis, or I have no idea. They haven't really released that yet, but the exception is possible.
All right. And of course, I don't think even those of us who come from a healthcare background have quite figured out the whole Affordable Care Act yet. And shopping for insurance wasn't never easy before, but there are people who are certified to help others understand and kind of navigate all of these new plans coming out under the Affordable Care Act. Can you talk a little bit about that and where people can find help?
Yeah, if they go to healthcare.gov and you just do some clicking, and if you'll see a little icon that says help in person or something to that effect. You click on that, you put your zip code in, and all these places will come up of people that can help you. And what you do is you just go there, they sit down at a computer with you, and they literally go step by step through the process. And they let you know, okay, well, this is what this means, that's what this means, and how much it's going to cost you. And it literally just goes through, and they try to find the best fit for you financially and medically. And it's a free service. People do not charge for that.
All right. And I'm sure there's going to be lots of people that need help going through that process. The other thing that is kind of the big deal with the Affordable Care Act is pre-existing conditions. And so there are many people who have been denied health insurance previously due to having a pre-existing condition. So any type of illness or medical condition that existed before their policy would go into effect as they're shopping for one. Marie, can you talk about how the Affordable Care Act changes that?
Yeah, absolutely. At this point, no one whatsoever can be denied in a health insurance policy, and once they get one, they cannot be thrown off of it. The only time where a customer can be thrown off a policy is for customer fraud. So once you are insured, you are insured. So any type of what was known as a pre-existing condition before, that's going to be a non-existent term. Everyone qualifies for healthcare now.
And that's certainly a good thing. So that opens up the door to insurance for a lot of people. Don't lie in your application, because that's how you commit fraud.
Right. Big thing is don't lie if you're a smoker. I was doing some research before the call, and if you are a smoker, the cost of the policies are through the roof. However, if you say that you're not a smoker and they find out that you are a smoker, the fine for that is huge. Because we have to remember, these are federal documents. These are government documents that we're filling out. So you do not want to lie on them.
Right. So in the long run, you're probably not going to save any money and maybe get in a big heap of trouble for lying about that. At the same time, though, because I was shopping around on healthcare.gov, and I noticed that there's actually a lot fewer probing health questions to lie about. Now that all of this pre-X stuff is off there, they're really not worried about quite as much, so there aren't as many things that you would feel pressured to lie about as you may have previously been. Back sort of to, I guess this is beneficial to both healthcare providers and consumers of these policies. I'm seeing that there's much more generous percentages being covered for out-of-network providers. Have you noticed that?
Yeah, absolutely. And again, a lot of that goes with, people are still paying their insurance premiums. If they want to pay a little bit extra and go out-of-network, they can. Hopefully with this marketplace, it's not going to be a big, huge issue. It's going to be at first, but the longer this has rolled out, more physicians will be within that provider network. So out-of-network, again, is one day going to be a thing of the past.
Right, and to explain a little bit more about how that works to people who may not understand out-of-network, in-network, and how those coverages work, let's say I'm a healthcare provider, Maria's a healthcare provider. As it may play out currently, Western Pennsylvania, I might be taking Highmark and she might be taking UPMC, and neither of them are going to let us carry both. And so if you are a UPMC insurance policy customer, you can only see the healthcare provider who's accepting UPMC. Or if you're the Highmark customer, you can only see the provider who's accepting Highmark. Unless your policy has what are called, you can always choose to pay out of pocket, but those costs can be exorbitant. So if your policy has what's called out-of-network coverage, it usually will specify, hey, we'll cover 20, 30, 40% of the bill if you go see a provider who's out of network. And what I'm seeing with a lot of these newer policies is those percentages are 50, 60 and above, which is almost as good as the regular policy. And so I think that that allows providers to see lots of new clients that they may not have previously been able to see, and it allows those clients to see healthcare providers without paying a whole lot of extra, and it gives them more choice in terms of who they can seek healthcare from.
Absolutely.
So is there anything that you think is important that we haven't covered so far in terms of the Affordable Care Act?
I guess the only thing we didn't talk about was prescription coverage, and that's also going to change dramatically. Right now, again, depending upon your healthcare plan, there's only a list of prescriptions that you can have. Now that is going to be expanded drastically, and that's also going to now include HIV meds, which previously were not on a lot of policies because HIV was considered a pre-existing condition. Now that that has washed away, a lot of these drugs that were used just for these pre-existing conditions are now going to be covered. So now these people who have diseases that prevented them from getting insurance before not only will have insurance, but now they'll also have prescription coverage in order to get better health care.
Right, and actually when you say that, it makes me think the way that policies have dental and eye care provisions is changing a little bit as well. Can you talk about that?
Sure, absolutely. With the marketplace, dental and eye is going to be something that's optional. So the more expensive your plans get, the more they're going to cover with that. Like the very bottom plan, I believe, does not have that in it at all, but I could be wrong about that. Just like, again, if you're familiar with health insurance, you have a company, you work for a company that offers it. A lot of times, dental and eye is something that's optional for you as well. So when someone gets into the marketplace, it's really not going to be any different than that.
All right, so that's very similar to what people are used to. My understanding, though, is that that still plays into kind of the tax credit thing. Wherever you're at in terms of the tax credit, if you choose that add-on, it's still considered in terms of your healthcare cost versus what you're being allowed through the government.
Yeah, absolutely. It doesn't. Your tax credit has no bearing on what policy you get. You can get the gold highest policy out there and still get the tax credit.
And speaking of those differences, let's talk a little bit more specifically about the different tiers, starting with the catastrophic plans. And the word catastrophic kind of comes from, well, the idea that you want it there in case you have any major medical catastrophe. Because right now, a person might say, oh, well, I only go to the doctor a couple times a year and they charge me maybe $100 out of pocket. Well, if I'm paying $100 a month for insurance, that's way more than I would spend in a year. Well, you think that until the first time you have an unexpected ER visit, and your bill is going to be probably a minimum $500 and up, depending on what services you need. And so that is one reason that many people, even when they think they're not going to use it very often, carry health insurance to cover those costs. And so the catastrophic plans kind of start in there. And then are based on percentages in terms of other services that they would cover.
Right. But even with the catastrophic plans, they still have that yearly wellness checkup that they will not have to pay any type of copay for, and all of the reproductive health and mammography services would still be on that. But that would have either a deductible or some sort of copay to go along with it. And the higher the tier you go up, the less your deductible and less your copays are. But you're exchanging that for a higher premium per month that you're paying.
Right. And of course, that's similar to how coverage works now, where people could choose higher deductibles, higher copays, and end up with a lower premium. So going from there, do you can you weigh in at all on the current UPMC Highmark war that's coming out of Pittsburgh right now?
Unfortunately, I cannot. The little information that I have, we're not allowed to release at this moment. The minute that I'm allowed to, I will definitely give you a call. But they're not really telling us a lot. Right now, it's just a lot of bickering back and forth. And yeah, so we're not quite sure where it's going to end up just yet.
Now I can't wait to ask you about that off the record.
I just do know a lot of agencies that are in Western Pennsylvania, a lot of employers that was using Highmark as their health insurance for their employees have switched to other companies just to get out of the whole debacle. I can't say that.
Right. So, yeah, it is causing a lot of people to switch or be uncertain. And I mean, the big deal is if you have Highmark, which so many people in Western PA do, UPMC is now choosing to not accept it in its network, which is UPMC actually passed up Walmart as the largest employer in Pennsylvania because they bought everything.
Yes,
so
they did.
UPMC, like if it's healthcare, UPMC may very well own it. Highmark's kind of been trying to catch up to them in terms of that by expanding their own network and buying a lot of practices and whatnot. In a way, I feel like them not being in agreement is driving competition, but at the same time, it also seems like they're excluding a lot of people from healthcare.
Absolutely is. I just feel like it's, two kids arguing on a playground. They're not doing anything. It's not helping anybody. And at the end of the day, they're hurting everybody else around them. Yeah.
Right. And then there's also like the mudslinging commercial campaign because UPMC is, of course, a not-for-profit organization, and so they kind of are held to the standard where they have sort of the public trust and they need to be charitable and they need to consider the fact that lots of people, even those involved with Highmark, have spent money and contributions and tax dollars that have gone towards building their company. Which, if you are more interested in the nonprofit side of that, all nonprofits have to file their tax returns publicly. You can find those online. One place to go is foundationcenter.com. You can use their 990 finder. The 990 is the tax form that's filled out by nonprofits. I have gone through and read UPMC's, and it looks like every director of every hospital in their network makes at least $1 million.
Imagine that. I'm so shocked.
On the other hand, Highmark's a private for-profit company, so they don't have to disclose any of that, and we may never know, although I can only imagine it's comparable or more.
Absolutely.
All right, Maria. Well, as always, it was a pleasure to have you on the show, and I look forward to seeing you again, hopefully soon. The next time we have some big news in healthcare, I'll be sure to have you back. And as soon as you can let me know what's going on with UPMC and Highmark, I'll be looking forward to that news. And as always, we would like to thank all of our viewers, whether you're joining us from Roku, Justin.tv, MondoClub.com, or watching here on our website at GayLifeTelevision.com. Be sure to follow us on Twitter and like us on Facebook. Until next time, I'm David Dean here at the Council.